Buenos Day. This hearing by the Committee on Innovation, Economic, Workforce, and Youth Development is called to order. It is now 9:04 a.m. For the record, and in accordance with 5 GCA Chapter 8, Subsection 8107, public hearing notices were sent on Thursday, May 11th, 2017, adhering to the 5 days notice, and a second public notice on Tuesday, May 16th, 2017, 48 hours prior to today's hearing. In addition, this hearing was noticed on the Legislature's website, www.guamlegislature.com. I would also like to acknowledge that we are Senator Rodriguez's public hearing for the Committee on Health, Tourism, Military Affairs, and Senior Citizens agenda, which will commence after our confirmation hearing for Mr. Mesa this morning. Joining me here is Senator Will Castro. Thank you so much, Senator, for joining me. Before we move on to the agenda and the latest nomination, I wanted to update the committee as a follow-up to our previous public hearing on the nomination of Mr. Bill McDonald as the Director of Bureau of Statistics and Plans. The committee received written and verbal testimony in favor and against Mr. McDonald. Written testimony before the hearing included testimony against him regarding a civil court decision. I invited Mr. McDonald to a courtesy meeting in anticipation of his confirmation hearing and to inform him of the testimony received and that I would raise it in the hearing. As the committee chair, I was not satisfied that Mr. McDonald could answer the questions asked of him clearly, and that despite me briefing him on potential questions, verbal testimony at the hearing was in favor of Mr. McDonald, but following the hearing, additional testimony against Mr. McDonald was submitted, as well as a request for previous verbal testimony in favor to be withdrawn by a member of the public. I have serious concerns, which I've expressed directly to the nominee and in a confirmation hearing. Although I have serious concerns, I do not want to act unilaterally and want to ensure that we as a committee, and ultimately as a legislative body that represents our island, should have an up and down vote. I understand his nomination must be acted on by the legislature within 90 days or the nomination expires. I anticipate submitting the committee report for the committee's consideration, and moving the nomination for the June session. Now that we have provided the committee update, we will move on to the agenda for today and the nomination of Mr. Monte Mesa to be reappointed to the Guam Economic Development Board. At this time, I'd like to call Mr. Mesa forward. Please be seated. Mr. Mesa, and please proceed with your statement.
Good morning, Madam Chair and Senators. Thank you for the opportunity to come before you. My name is Monte Mesa. I'm currently a resident of Mighty, and I'm currently employed with Guam Premier Outlets, and oversight also of Tuman Sands Plaza. I'm currently serving also as a GVB board member, and I also are involved in several civic organizations with the Rotary Club of Guam, with the Guam Chamber of Commerce, and also some community organizations such as the Guam Nikkei Association, as well as the involved in my church at Blessed Diego, Santa Torres Church. I'm here today, Senators and Madam Chair, to really offer my services to help our government and help our community in sustaining economic activity and provide jobs for our future young residents who can take potential job opportunities in our tourism industry. we have an opportunity to develop further our tourism industry, not only with bringing potential tourists by airplanes, which we do have today, but the bigger opportunity is to look at bringing shiploads of people here in the form of cruise ship business, both port calls as well as potential regional cruise development, not just for Guam, but for the entire Micronesia. I'm here today to offer my services to continue to do my role in encouraging development projects with GEDA, of course within the confines of what the authority is authorized to do, and make available resources, both federal and government resources that would help local entrepreneurs to access and be able to encourage entrepreneurial spirit and have our local people be their own bosses rather than looking to work for others. And I'd like to encourage that by letting our local people know that there are avenues and resources available if they're turned down by traditional banks. GEDA has funds to make available for such opportunities for people who have the passion to execute on their dreams. And this is one of my passions as well, is to help drive this business activity in my role as a GEDA board member. Thank you.
Thank you very much, Mr. Mesa, and thank you for accepting the governor's appointment, and thank you so much for your previous service, and we look forward to you continuing your role at GEDA, on the GEDA board. I do want to recognize to my left Senator Dennis Rodriguez, and to his left Senator Talina Nelson. Thank you so much, colleagues, for joining me, and at this time I'd like to open it up if anybody has any questions for Mr. Mesa. Okay, Senator Nelson.
Mr. Mesa, good morning, how are you doing? Sorry, I don't mean to get straight to business, but good morning, how are you?
Good morning.
And thank you everyone for being here. Are you also a member at GVB?
Yes, I'm a voted member.
I see.
Voted by the board of directors.
And can you just, during your time as a voted member, can you explain some of the initiatives that you've done, and also what you'd like to see in the way ahead, and how you would help that with the capacity if nominated as a GEDA board member?
Yes.
Thank you.
Two things. I also, just for background, I also serve as chairman for GVB in the earlier administration of the current administration. But the two initiatives that I helped promulgated and helped put into the 2020 vision for GVB is one, to add hotel room inventory for our tourism industry, and not just any hotel room. Actually, the 1,600 rooms that we projected for our 2020 expansion and development is actually for high quality rooms. And these rooms we don't have these rooms today. We have something close, which Dusit has come into the picture. But we're looking for more upscale customer base as well, which we don't have that niche at this point. And I think that we need to revisit the 2020 vision that was promulgated. And when you look at that, the 1,600 rooms actually that we're looking for, when you look at the report, it's for higher end rooms to attract potential hotel developers or operators such as Four Seasons, the Ritz-Carlton, or Amman type resort villas. And that's a niche that we're missing. And that is where we're looking diversification to come in. So this is one thing that relates to GEDA in pushing this initiative, is to, of course, highlight the QC, the special QC program, to try to invite this type of development into Guam. We have enough economy class hotels and mid-price hotels, but we don't have really to attract the high-end spenders or families that want to bring a larger group of family members to spend and celebrate the occasion. We need high-end home-style villas that should be outside of Tumon. And this is one of the strategies, is that we said we want to bring tourism outside of Tumon. And I'm glad that Senator Rodriguez and Senator Regina are looking at a potential opportunity in southern Guam that would hopefully embrace the desires of our southern community, who would like to hopefully get job creation projects in the South that can be done, that would lead into this tourism industry platform in accommodating villas in the southern area of Guam, because the beauty of the southern would enhance this type of concept. And that's one. The second thing that I'm looking at GVB, which is in the 2020 vision but not specified, is developing the cruise industry, as I mentioned earlier. We need to do more in promoting Guam for port calls. Today, we only have at least 1 or 2 ships a year. When I was chairman at the Port Authority of Guam, we had 12 ships come into Guam in 1 year. This is an opportunity that we've lost, that we've not yet cultivated, and the cruise industry for the global area is growing. And this is an opportunity for us to look at the future growth of sustainable tourism for Guam is the cruise industry. And being in GEDA, this is where we would look at providing some incentives to any one of the 3 major or 4 major cruise companies that are now doing business in Asia. And we need to, from a GEDA perspective, we need to invite any one of these 4 major cruise industries to really look at Guam and look at Micronesia region, so that they can see the opportunity as they've done in other regions like the Caribbean, like in the Mediterranean, and of course even in Asia itself as it continues to develop. So these are 2 major sustainable tourism projects that we need to really focus on, because that's how we can continue to diversify, but also to have a right size tourism number that can continue to generate the revenues to support not only the hotel occupancy tax, but also the GRT that really adds to the local economy. I invite you guys to look at really our current situation today. Yes, we do have a lot of visitors coming to Guam. The diversification strategy is working. However, when you look at the tax base, the GRT collections compared to previous 10 years, you will see, and this is something that I'm speculating at right now, because I'm not privy to the tax information, but your office could attain that kind of information to see really the comparison of the GRT collections based on previous tax collections during the time we had the majority of visitors coming from Japan. And you can see, at least just based on our rough calculations, that we are not getting the GRT tax base that has been derived by our visitors in the past. There are other tax being generated, but when you take the component of just the visitor markets and take that and compare that 10 years ago, I will not be surprised that the GRT being generated by our current tourist mix is not at the same level. And I ask you to look into that, because this is really where we need to watch closely the diversification of our market. Because unlike other larger tourist destination, we really, today, if we have the right mix of hotel rooms, we don't really need 2 million people here. We actually can still make enough tax revenue source from our visitors if we have the right balance and the right mix. And again, pricing ourselves to be competitive with other destinations within our market area. We don't need to overload the island with visitors to generate what we need. We just need to be able to present ourselves, the island itself, to continue to be an attractive destination, but also an improved destination. And this is the other role that I play at GVB, is taking over the destination management. We really need to clean our backyard. And after over 50 years now in the tourism industry, we need to upgrade. And I'm glad that we're seeing some of the funds that you guys approve for this current year being spent wisely by improving some of the lighting, and now it's reflecting the services that we see now with those funds that you've allocated, and we're spending it in the right place to improve our destination. Just like your home, if you don't want to invite people to your home if your home is not presentable. And this is what we need to do today to continue to sustain our viability to inviting new guests, but also bring back our old guests who have visited Guam to see that there is something better, and that the quality of their visits to Guam and their experience is better than what it was 10 years ago. This is our continuing challenge.
Thank you, Mr. Mesa. I'm glad that you hit home with the improving the destination. I also want to encourage you to be a strong force in preserving our island and its culture and its natural beauty, especially as far as we pertain to development, because that's always a very sensitive word here on our island. We're limited with our land space, and we need to really preserve our natural resources. So thank you very much for that. You have a wonderful day, sir.
Thank you.
Thank you, Senator Nelson. Senator Rodriguez.
Thank you very much, Madam Chair. Today, Monte, thank you very much, and congratulations for your reappointment. I support you. I really appreciate the work that you do. Aside from your real day job, you still have a lot of time to be able to contribute back to our community. I think you really have a perfect mix of experience when you were at the Port Authority, at GEDA. You've been there for some time, and also at GVB. I think what you've talked about regarding the cruise industry and about diversifying our tourism is you bring in a wealth of knowledge and a wealth of wisdom and experience in doing that, and being able to take us to that next level. And so I work very well with you. I know we're working on the Inarajan revitalization plan, and hopefully we can get that moving, because that is really part of diversifying our tourism, but also it provides economic development, especially for our residents in southern Guam. So I want to thank you and pledge my full support behind your confirmation and the work that you do at GEDA. Thank you very much.
Thank you, Senator.
I'd also like to acknowledge Senator Luis Muñoz, who's joined us. At this time, Senator Castro.
Buenas, Señor, Madam Chair. Hagasahutumasi, Señor Mesa. I do want to state for the record, I appreciate your contributions to the community, especially, most notably in your capacity as the General Manager of the Guam Premium Outlet. Over the years, I had the opportunity to see local organizations display their cultural wares, and also to proudly practice their cultural arts and other performing arts on your premises, and so I appreciate that. So I also noticed in your dossier here, so your service to your parish, so Situs Masikuri no Sepishonmo para no Blessed Diego San Torres Church. Most admirable is the fact, but I do have a question for Mr. Mesa, so hopefully this doesn't trip him up too much. Most admirable is the fact, in my mind at least, as a growing member of the community, mampus no patung hao gi finota. Lo disi pago ti utungo hafa no gira gi finot tomorrow. Is it net nun business guahan? I don't know. You don't have to answer that, Mr. Mesa. But to summarize, Madam Chair, I do support Mr. Mesa's nomination or renomination and confirmation to the board, and I appreciate your contributions as one of the most knowledgeable men in the industry. Thank you for your advocacy and preservation of our cultural languages and practices, whether it's Chamorro or Filipino, Balawan, or what have you. Thank you, Mr. Mesa.
Si Sus Marcelo kay Senator Lau, utunga na si Senator Nelson mention na I katura dyan I resources gi itanota upititehir ki edzo and balance and si tezo na ta balance sa both I katura I resources ni kaya gini tano debya na ta pertehi lo debya lo kinata atan hafa sinya mas tatsogi ni sinya na mas maulik I duraton I tawtaw siya ni sinya mas man maguf sa mas mas may kay sinya ma-experience sa angin tita balance I development pes siyempre ti sinya man nanofot na man sasagay ti sinya no mas mali afa otro sinya tatsogi como ti gua development.
Por eso na punto na Señor Mesa, angin tunanas na ikareromo, pues sempre no mas tunanas I planota. Thank you. I appreciate that.
Si Sus Masi.
Jesus Masi. Senator Munoz?
Half a day, good morning, Monty.
Half a day. Good morning.
I feel a little awkward that Senator Castro is calling you senor because it just makes you seem so much older, but I do
Just
know
the
that...
gray hair.
Just maybe that's what it is. I just want to acknowledge that you know, from just based on your experience alone, from the port to GVB, and the type of community projects that you've been involved in, to what you will be bringing to GEDA. So I just wanted to acknowledge that and congratulate you on this nomination. Thank you. Welcome.
Thank you, Senator.
Thank you, and thanks again, Mr. Mesa. I really appreciate the opportunity to have met with you prior to this hearing and to discuss some of the passion that you have and the focus that you will be bringing to both your role, hopefully with the reconfirmation at GEDA, in addition to your simultaneous service at GVB. I think that really is helpful to both boards and is helpful to the people of Guam. We did discuss this, and I think for the record, I just wanted to give you an opportunity to respond about local entrepreneurs. And many local entrepreneurs have ideas and visions for various types of businesses, and we discussed a little bit of their difficulty in accessing capital to prove their concept or to do their startup. I wanted to just ask you about what GEDA is doing today and what you think GEDA can do in the future to make sure that we give these entrepreneurs every opportunity to create local business and to grow their businesses here on island.
Yes, thank you. That's a very good question, and I think this is something that we need to continue to advocate and promote to our local students today, as well as students at the university level where they're now embarking in a career path. And the message to all of them, to the students of Guam and to the young people of Guam, is that they need to think about encouraging themselves further to be their own bosses and think of their own ideas to create their own business. And this is something that I think we as a community need to continue to promote, advocate. I take an example in my travels, and I look at different countries and how they inculcate the communities and their young people And I take an example, an illustration from Singapore. Singapore is a country that's really growing today, and a lot of the young people there are encouraged to do their own business, make their own business, come up with creative ideas. And at GEDA, I am looking to advocate that for our local people, to, again, look at areas that can relate to the tourism industry where people can develop their own crafts, uniquely made on Guam, promote the made in Guam products, and also encourage new ideas, such as we have a very successful group of young gentlemen who created the Crowns label. We need other ideas like that younger generations will be able to think of, that will multiply in terms of the demand. With today's technology, with our social media and this, special electronic gadgets that everybody has today, this is a way that, again, will encourage young people to be, hopefully, entrepreneurs and use this technology today to advance their dreams. And their dreams, whether it's creating a product, creating a service, or creating movies themselves. We have young entrepreneurs, the Munier boys, that are into this film making avenue. This is hopefully a good example for others to follow. And these are something that we like to incorporate and encourage. And we do have funds at GEDA for those that have been turned down by traditional banks. And it's designed to help local entrepreneurs to access these loans and be able to get funded to at least get their business started, as long as they can present a business plan. And with that availability, the program is ongoing, but we need to be better advocates in promoting this in the schools and promoting it to the university students or GCC students as they start to come out and really work in the real world, so to speak, to have this access.
All right, thank you so much, Mr. Mesa, and I agree with you. We can have the best programs in the world, but if the people who need them aren't aware of them or don't have access to them, then that's a real problem that I'm really glad that you're committed to addressing. So again, thank you so much for your commitment and for agreeing to serve in this capacity and for your service to the people of Guam. Sijus Masi, Todosanju Put Ifanatan Muzu Pagu, the Committee on Innovation, Economic, Workforce, and Youth Development has duly heard the appointment of Monte D.M. Mesa as a member of the Guam Economic Development Authority Board of Directors. Written testimonies may be submitted by emailing Senator Biscoe at guamlegislature.org, or you may hand deliver them to our office at 163 Chowden Center Papa in Hagåtña until Friday, May 26th at 12 noon. This hearing is now adjourned. The time is 9:33 a.m. Sijus Masi.
Thank you.
Today and good morning. The Committee on Health, Tourism, Military Affairs, and Senior Citizen now convenes this public hearing. Public hearing notices were given to the media. First notice on Wednesday, May 10th. Second notice on Tuesday, May 16th. For the record, today's Thursday, May 18th, and the time now is 9:35 a.m. I want to thank Senator Biscoe for accommodating us this morning and having us being able to have this hearing after her confirmation hearing that she just previously had. The committee will hear and accept testimonies, both oral and written, on the following: the executive appointment of Ms. Mayfei Muko as the general public member of the Guam Board of Social Work, and also Bill 30-34, an act to repeal and reenact Sections 1103. This is relative to the Medical Referral Assistance Office. I want to recognize my colleagues who are here this morning: Senator Biscoe, Senator Will Castro, and Senator Luis Muña. Thank you very much, Senators, for being here. First on the agenda is the executive appointment of Ms. Mayfei Muko. Thank you very much for being here. Before I recognize you, I want to just recognize and acknowledge those that have come this morning and signed up. I know you've all indicated that you're here as a supporter and you're not going to do any oral testimony. So thank you very much for being here. I'd like to also state for the record that we've been receiving my email is off the hook. We've been getting a lot of email written support for your executive appointment as well. So thank you very much. And the committee will continue to accept any written testimony until such time we report it out and have it on the session agenda. Okay, so I'll go ahead and recognize you for any opening statements you may have.
Good morning, Senator Rodriguez. First and foremost, I'd like to say thank you for having me here this morning and telling you a little bit about myself. And I feel that it's important for me to be in this board. I did not attend the University of Guam, and although I feel that they produce wonderful social workers, I graduated over 20 years ago when UOG was not accredited. Therefore, I took my education off island, but I returned home because I loved our island. I am not a BSW. I do hold a bachelor's degree, but in recreation. I'm also a recreational therapist. I went to the School of Health and Human Services at California State University, Long Beach. When I arrived, the qualifications to be a social worker was just that as long as I went to a recognized school in health and human services, I qualified. I started from the way bottom as a social worker 1, 2, 3, and now a supervisor. I also, because I'm a recreational therapist, I also worked at the hospital part-time. I worked at CPS, had wonderful mentors from Lydia Tenorio and Joe Diaz and so forth. I worked with individuals in the military back in the days with your mother, Rosita Biscoe, and so forth. And I wanted to give the community what I had, so therefore, as a social worker, I also worked part-time as a recreational therapist, actually a therapeutic recreational activities coordinator at Guam Memorial Hospital. I also worked at Guam Legal Services, so I've had experience not only in the public sector, but also in the nonprofit and private sector. Currently, in my position, I work with many child-serving agencies. I work with the Bureau of Social Services Administration, where we have the most social workers. My concern with this board and why I'd like to be in it is because of the fact that I do not hold a BSW. I do understand that I will be exempt and grandfather in. I was told in the past to get the 3 recommendation letters to hold my current position. I've got that, but we haven't moved forward. I'd like to move forward with this board, and I'd like to work with my colleagues who also hold other degrees, unlike that's not social work. I'm concerned about that, and the reason why I'm accepting this is to move forward in the board and making policies and procedures happen. Thank you.
Thank you very much. Any of my colleagues have any questions or comments? Senator Lee?
Thank you so much for accepting the executive appointment, and we look forward to supporting you. Thank you so much for your previous service that you've already done. And yeah, you mentioned my mom, and like you said, I grew up in a home with a social worker, so I know exactly the kind of grit and the kind of determination and dedication to our community that it takes to put yourself out there in a field that is so difficult and so it's a thankless job for all of the hard work that you put into it. I know you get a lot of thanks from your clients and the people you serve, the children that you serve, and our island's families. But I personally want to thank you so much for all the service that you've done previously and for what you're going to continue to do, hopefully, as a member of this board. One question that I did have, I am all for making sure that Guam is number one, that we're number one in education, that we are the healthiest community, that we're number one in giving our children great opportunities to live healthy and productive lives. It's also my understanding that we're ranked, if not number one, pretty high to number one in rape and sexual assaults. And so I wanted to ask you what programs are being pushed forward by the Guam Board of Social Work, what current programs they have, and what we can continue to do to address this very real problem on our island that's affecting our entire community and our families.
Well, first and foremost, I haven't spoken to anyone who is currently in the Guam Social Work Board. I understand that there's only one board member. I don't know if there's another. So I haven't had the opportunity to even speak to anybody on the board. I could only tell you from my office and what's going on. We work closely with Healing Hearts. We do have the SARTS meetings. We're trying to ensure that all the service providers come together. We hold meetings once a month with GPD, DART, and other serving agencies in the community to ensure that we're doing something for our community and trying to enhance those services. I sit on many child serving agencies to ensure that education for our children is being met, or even the disabilities for our children. We actually have a meeting on early childhood this Friday with all the child serving agencies. So we're doing what we can with what little resources that we do have, and we've always had that problem for the last 20 years. We could only move forward, and we do that with the help of the community and with all the outreaches that we do and networking that we do. In my current position, I work very closely not only with our local community but also with the military and all the nonprofit organizations. We just ended Child Abuse Prevention Month, Foster Care Month, and I played a real role in putting those agencies together to come forward to do those outreaches this last month.
Thank you so much for that very thorough answer. I also want to thank you for the commitment and the dedication that it took for you to make sure that you were educated, and that for taking those skills and your expertise and bringing them back home to serve our community. So again, I look forward to voting in favor of your confirmation. I know it's very difficult work, so I want to make sure that you're committed to self-care as well, and giving yourself a pat on the back for all the great work that you have done and you will continue to do. So, Sujus Maasi, thank you. Thank you, Mr. Chair.
Thank you very much, Senator. Senator Nelson, thank you very much for joining us. Do you have any questions or comments?
I just wanted to say thank you very much for being here, and congratulations. I look forward to supporting this appointment. And thank you very much for all that you do, especially for the children.
Thank you, Senator. Senator Muñoz?
I'm actually still reviewing your resume. It's very long and very impressive, I must say. So I see that you've been involved in so many different programs and conferences. Is this something that maybe you would like to, because sometimes some conferences that you have could be even related to today, even though they've been done many in the past, many times. Is this something that you'd like to bring to the table, like, and maybe reinstate some of these conferences that you had before, some of the drug conferences, and I'd have to re-look at that. When they asked me to put my resume, I think that was updated in 2014 or 2015. From there, I've been attending many other conferences, but
You mean there's more than what's on here?
yeah, there's
Wow.
more. Okay, but I'd like to, you know, put things on the table and bring it. We are federally funded. Not only because I worked at Guam Legal Services, I was very familiar with all the federal grants and the mandates and what we have to do and why we hold these conferences and why we get the numbers so we could give it to the Fed so we could continue to have money. So I have that experience as well. I would like to have more conferences, but it's also depending on the budget and what also is entailed in any federal grants that's presented to any agencies.
Okay. Well, thank you very much. I look forward to supporting you as well, too, Nathan.
Thank you.
Afternoon, good morning, Ms. May. Did I hear you correctly that you attended the university?
I attended
UOG.
California State University
Did
in
you go
Long
to UOG?
Beach. I did not go to
Oh,
UOG.
okay. I thought so. I was just wondering if I thought I heard that you had attended the University of Guam, because I didn't see that. But I do want to commend you for stepping forward and accepting the nomination, and I am inclined to support your confirmation because of your extensive and varied experiences. You listed a lot: CPS, public health, Guam Legal Services, and of course the entity that's probably in the greatest need of our continued support, the Guam Memorial Hospital. I do have a second question. I noticed you listed Chief Justice Merriman as a reference. Could you share your association with the Chief Justice?
When I first started as a social worker, she was the judge she was the, what do you call that, the Superior Court judge, Juvenile Division back in 1994 till 2003. So she heard many of my cases. She took in and my calls early in the mornings and so forth, and I still established a great relationship with her. So she was the primary judge when I was really active as a line worker in Child Protective Services.
Thank you. And I'll close, Mr. Chairman, by saying, and to your credit, Ms. Muiko, I'm glad to see another strong, educated, and invested woman in our community step forward in a leadership capacity. Senator to my left knows that another strong woman co-leads my household, so thank you for accepting.
Thank you.
Thank you very much, Senator. And Mayfei, thank you for stepping up and making yourself available. I want to thank you. Of course, I want to also recognize your mom for being your family, for being here. Thank you very much for raising such a beautiful, kind-hearted individual. So you're to credit for a lot of what she has done. Thank you. So, Mayfei, you have my full support. Have you attended, I don't know if you said you attended any social work board meeting yet? Or are you familiar with what the...
I do not know. I heard that I do need to attend. Unfortunately, just like you said, take care of yourselves. I am going on a long sabbatical next week.
Okay.
So I look forward to working with the board once I return back from my trip.
Okay, because I know there's some. I don't know where they're at with actually issuing licenses. I know they were working on the fee structure and working with an online provider, I believe. So those things you should get yourself up to speed on. And if there's any support or assistance that you need from the legislature, you know where to find us. Right? But thank you for the work that you do, and again for stepping up and taking on additional services.
Thank you.
God bless. Thank you.
Thank you.
We'll move on now to the next item on the agenda, which is Bill 30-34. I'd like to call on Mr. Terry Quavo from Guam Cancer Care, Ms. Kathy Castro. I believe she has written testimony. Is there anyone else that wishes to provide any testimony? You're here. Okay. I want to recognize Bethany, of course. She's here. Thank you very much. Thank you very much, Mr. Quavo, for being here. Bill 30 is really in response to concerns that we receive from the community, most especially from those of our people who have to travel off island to receive specialty care. The Guam Medical Referral Office has been operating for many, many years, and perhaps when it was first established, it made sense. It made sense that we had a provider that was located in the destinations where we send our patients, the Philippines, Hawaii, Los Angeles, Their services they were to pick up our patients from the airport, take them to the hotels, and then to their hospital or doctor's appointments. But as time has passed, things have evolved. We have hospitals like Good Sam, St. Luke's, the Medical City in the Philippines, Hawaii, the hospitals we send our people to now that actually provide the services that our medical referral office does. And so when we took into consideration the concerns of our patients there, knowing firsthand, seeing the data on what is expended to fund this medical referral office to a third party, we thought that it was appropriate to now reform how this program has been operating. And the money that we're using to fund this operation could be better spent on perhaps a voucher, developing a voucher system where we can provide our people this direct assistance to be able to use to get transportation. If it's transportation, we know the public transport system in the States or even the Philippines is very efficient, or have them use it for to help them pay for lodging. We know that they spend a lot in lodging, and sometimes the funding that they receive either through the programs they're in run out, or have them be able to use this to purchase their medicine, because that's what we hear is that when they're out there for a prolonged period of time, they would need to get refills, and resources is very thin for them. And so if the policy is that we're going to continue to provide this type of service, that we look at how we're doing it and perhaps do it this way so that our people has direct benefit over taxpayer resources. And a lot of the services that we're doing now is redundant. As I said, hospitals do it. Even I know some insurance companies that send their patients off island also provide this type of service. So this is what this bill does. It gives the opportunity for either the governor's office, still being run by the governor's office, that they coordinate this program, and if they do it, that 15% is capped for administrative costs. I know that coming from the nonprofit world, you know that how much more efficient you guys could be in running programs such as this. And so I want to thank you for being here and acknowledge and recognize you for any testimony.
Thank you for allowing me to testify on Bill 30-34. For those who don't know me, my name is Terry Quabo. I'm the Executive Director and Co-Founder for Guam Cancer Care. Our program has been in existence for 7 years, and in the last 7 years, we've helped over 1,600 people get access to cancer care. And similar to what the MRAO does, that's what we do specifically for cancer. And in fact, I'm here to testify in favor of Bill 30-34. I commend Senator Rodriguez and Senator San Augustine for introducing this bill, because it's a way of thinking outside the box and really look at what the needs are. And I totally agree with you, because with all of our patients that are being referred off island, gone are the days where they just need a ride from the airport to the hospital, because it's already being provided. What we see from our patients are, like what the Senator Rodriguez said, the need for other support services, whether it be lodging, whether it be transportation, whether it be copay assistance, or buying pharmaceutical drugs that they need while they're there. So I like the fact that this bill is really putting the money to the people that really need it for the purposes of getting access to care. In fact, the way it is written mirrors one of our programs, which is our financial assistance program. And how our program works, it's similar to the voucher system, where we qualify patients from getting either $200 to $1,800 a quarter, based on what some of the statistics in this bill were. $407 per patient per quarter spent in the Philippines, up to $712 per patient per quarter for LA. But is that going towards operations, or is it going towards actually getting them access to direct care? Our FAP, Financial Assistance Program, if you're given $1,800 a quarter, it can only be used for getting access to care, whether it be lodging, and when we're talking about lodging, it has to be directly related to the medical referral. You can't use it for vacation. It has to be for the stay at Good Samaritan or on a hotel near the hospital, whether it be for transportation. We use our funding to give monies to patients in LA to take the Amtrak to get from their house in San Diego to, City of Hope, for an example. So I like the fact that this is really thinking outside the box. In the Philippines, and for many who go to the Philippines, I don't think we really need a driver that's paid to sit there and wait for Guam patients when you could easily get a Grab taxi for $2 to get from your hotel to the hospital. And a lot, like the senator says, a lot of the hospitals, St. Luke's, provide those basic services. We have to find a way where we're looking at using our limited tax dollars for the intended purpose of getting people, our fellow Guam residents, to get access to care. I know it's been a burden for our patients on Guam, where when I first started at Guam Cancer Care, where before you could send a patient to City of Hope, they would say, you're going to need $2,500. How do you tell an indigent person in our community that you have to have $2,500 in the bank before you could get referred there? They did away with that because that was not proper. How do you tell a cancer patient not to go because you don't have money to pay for your lodging? This bill, if it becomes law, it could give these people, our indigent population, the ability to say, I want to use this voucher system or this grant to use it to pay for my lodging. And that's why I really like what this bill does. It really levels the playing field to get people access to care. It's really thinking outside the box. It's really putting the money, and I like the fact that you're trying to cap it and saying that, okay, if the governor's office wants to do it, at least 85% of the money is going to the patients who really need it. It's not to cover general operations of a program where, what does that $407 per quarter for our Guam resident in the Philippines pay for? Is it to pay for a driver that's sitting waiting when we could just take a Grab taxi to St. Luke's for $2 when they really need it to get pharmaceutical drugs, or maybe they need it to pay for their lodging? Guam Cancer Care pays for a lot of lodging costs in Philippines, Hawaii, and LA. And I like this because our program is even capped. Our patients that are there, once their money runs out, they're having to scrounge around to find out where they're going to get that additional resources. So I truly appreciate what this bill does. It's really putting it to the people who really need it for the intended purposes of getting them access to care. So I again support Bill 30-34. I think it's a right move. I commend Senator Rodriguez, Senator Sinagosine for introducing it, and I hope that the rest of the legislature supports it, because I think it's a good bill.
Thank you very much, Terry. Just a quick question,
Sure.
and then I'll ask my colleagues they have it. The bill calls for the medical referral office to develop some sort of algorithm to determine legibility, because we understand that not everyone that comes in may have that need for direct financial assistance. So this is, I got to state for the record, this is going to change, because the way it works now is that you come in there, at least I believe, maybe he knows, he was up at the governor's office as well, is that you come into the medical referral, whether you have private insurance or not, and you seek the services of the medical referral office, and then they coordinate getting you picked up, if that's what it is, in whatever destination. So the way this works is that any resident will still be able to come to the medical referral, but not everyone will be able to receive a direct financial a voucher, if that's what it is we're establishing. So how has Guam Cancer Care developed that sort of algorithm?
Well, thank you for that question, and we actually do that, and that's why we have a range of $200 to $1,800, and it's based on need. So they provide their income and based on the poverty levels. So someone who makes a certain amount of money may qualify for $200 a quarter. It's not everything, but it does help. And so the mechanism, what we do is the most needy gets the most financial aid. It's not a reward system for people having cancer. It's not a reward system for people who are getting referred off island. The amount that's determined is based on income levels and whatever finances that they have. And for the past 7 years, we found it to be more equitable. And in fact, again, I want to reiterate that once they get that award,
they can't use it for whatever reason. They can only use it to get access to care based on what the medical referral says. So when our staff looks at the cost, we always double check that is this directly related to their treatment. So if they have a hospital bill that we're paying for and it's in Philippines, but their treatment is in LA, this is not related. We actually look at the doctor's notes and we reimburse costs that are directly related to access to care. So we find it very effective. So if MRAO can develop an algorithm or methodology that can level the playing field to award certain grant awards to patients based on their income, I think it could be effective. I think there's so many ways that this program can be run to be very efficient.
Great. Thank you very much. Senator Lee, you have any questions?
Hafiz, Harry.
Hi.
Thank you so much for joining us. Thank you for your testimony, and also thank you for you and for the Guam Cancer Care team for everything that you do for our families and for the people that need your help the most. I wanted to ask you a little bit more about the program that you have that's similar to this bill, because I have some maybe questions about that. Within your program, the money that's given, it's a reimbursement or it's a grant?
It's a grant, and what happens is the patient works with their navigator, and in this case, it could be the MRAO representative, and they could say, part of my grant, I want to use it for lodging.
Okay.
So what happens is we could either pay directly we actually pay directly to the providers themselves. The patient never receives the money. So if it's lodging assistance, we pay directly to like St. Luke's Medical Center, or if it's transportation, we pay directly for the transportation cost. If not on a reimbursable basis, we never cut monies to the patients. It's only to providers or companies that provide these direct support services.
Has there ever been, in your experience, patients that are in such dire straits that they have difficulty kind of accounting for their healthcare needs, and they require a family member or a trusted friend to do some of the work on their behalf?
Sometimes there is where their condition is really deteriorated, where they have someone speaking on their behalf. They have to write that. They have to give permission to their family member to speak on their behalf.
And you would work with that person
Absolutely.
to make sure that the resources are available for them and their needs are met?
Correct.
Okay. I also wanted to ask if you have kind of like an information booklet that's provided to patients, given that you've had so many families and patients that you've helped in those areas. You were mentioning LA, you mentioned Manila, going off island for treatment at those different places. I'm sure that you've kind of collected, a bunch of information and tips on how to navigate the system and resources that are available in those locations. Do you have information like that?
Absolutely. I'm glad you bring up this question, because it's kind of looking, and I can only speak for cancer-related services, and what we're doing, in fact, next month to kind of, we always believe information is power. For cancer-related services, Guam Cancer, in fact, is launching a new interactive website, which is going to have like a forum where people can communicate some of the issues. Like you could post something where I'm going to LA, City of Hope, what kind of services are available.
Oh, that's great.
So people in real time can ask these questions, and people who have the experiences or doctors can post general information that can help. Because, information is power. And when you're going to, say, Luke's for the first time, you want to know what my limited resources can do. Where can I go get the cheapest hotel rooms, or what other nonprofits can provide different services. So that's going to be unveiled next month, but again, that's specifically for cancer. We're trying to streamline how we could provide better services to Guam cancer patients. But in regards to this bill, I think long-term there should be ways to spread more information about how people who are getting medically referred off island can maximize the resources that are available to them. Because there are numerous services available to Guam residents wherever they're at. And that's where it's important for a navigation program, not just for cancer, but for other ailments. I know the senator asked me before is how can we duplicate what we do for cancer with other NCDs? And I mean, I can't solve the other NCDs. My focus is currently on cancer, but we're trying to mirror what we do to make it efficient to people with heart disease or diabetes, how we could help them out as well. But in the future, to share these resources for cancer related, we are going to be launching an interactive forum, like a web posting of information, and it should be unveiled next month.
Great. Thank you so much, Mr. Quavo. Thank you, Mr. Chair, and I'm so glad that you created this space for us to discuss this very important issue in our community and making sure that we give the resources to the people who need it the most.
Absolutely.
So thank you. Thank you both.
Thank you very much, Senator. Senator Muñoz. And before that, I want to recognize the Vice Chair, Senator San Agustin, and also the co-sponsor. Thank you, Senator, for being here. Senator Muñoz.
Good morning, Terry.
Hi.
You know, I know that you're here in support of the bill.
Absolutely. Yes, I
And
am.
I'm sure that the medical referral office could learn a lot from your foundation. I know that cancer is very sensitive. You know, that the disease is such a sensitive issue, and no matter what your financial status is, the vulnerability is just there no matter what. Have you ever turned away, has Guam Cancer Care ever turned away someone for financial assistance, no matter, based on their income?
No, we have not. But there is one caveat for our financial assistance program is they have to be a Guam resident because we use tobacco taxes that's awarded through Public Law 3080. So we have gotten interest from family members that are residing in the States or people from Saipan coming to Guam and trying to avail of these financial assistance, but it's really specifically for local Guam residents, and the priority is you have to try to get your treatment on island if the services are available. But they could use their resources for whatever purposes as long as it's for access to direct cancer care. So to answer your question, for Guam residents, no, we have not. But for people from all over the world that come to our website and says, is this services available to us? To clarify, if a Saipan resident came to Guam and trying to access care here through their medical referral office, we provide whatever services we can provide, whether it be transportation, whether it be pharmaceutical supplies, but we can't provide them that financial assistance if they're not a bona fide Guam resident.
Okay, thank you.
Thank you, Senator. Senator San Agustin, did you have any questions or comments?
No, Mr. Chairman, but I'm just hoping that the bill will get a successful approval by our colleagues. Because when you look at the bill, and for everybody else, it's similar to what some of our colleagues are saying. It's right-sizing the government. Let's not keep just spending money when we can put money to best use.
Absolutely. I agree with you, Senator San Agustin. I really, truly appreciate what you guys are doing with this bill. It's really putting the money to people who really need it.
Thank you, Senator. Senator Castro?
I do, since we have Mr. Quabo here, who is very knowledgeable about the industry. I'm particularly pleased, Mr. Chairman, and to your co-sponsor with this one provision on page 3, line 10. Typically, my style in terms of how I approach legislation is not to be overly prescriptive, but in this case, I see a tremendous benefit to the community by getting some, at least prescribing the need for a satisfactory survey or some kind of perceptive study as to the level of customer care that the government is providing, in this case, the medical referral office. In your opinion, how do you envision this manifesting itself? Or are there other experiences gleaned from other jurisdictions that this is emulated from?
Well, for me, I can't refer to any other jurisdiction, but referencing what you said about conducting a needs assessment, I truly believe that's important too. I mean, for us in our industry, we're trying to conduct a needs assessment to see what cancer patients feel that they need, or what is important to them, or what areas of emphasis should we focus on. I truly believe moving forward that a survey should be conducted on all the patients that went on medical referral and to determine what types of services should be covered, because they're the ones that are going to tell you that the focus should not be on just transportation to and from, their hotel to the hospital. It could be lodging assistance. It could be a variety of other services, direct support services that should be covered. And let them dictate how the program is developed. And I appreciate the fact that it's kind of open-ended how you guys structure it in creating the methodology, not only of creating the cap, but also making it structured to the people who need it. They're the ones that we're trying to amend the law to benefit. Let them dictate where the money should be used for and what areas are important. So I agree with you. I think we don't need to emulate another jurisdiction. We could build it from our own, but let the people decide through a survey of what the areas of emphasis should be.
Thank you for that. And the reason why I bring this out, the other point, but I'll bring it up with the chairman and the committee as on this issue of, again, being prescriptive for a HIPAA-compliant quality improvement program. I can acknowledge the need for ongoing programmatic review and improvement. I'm just not necessarily convinced that we need to prescribe it through HIPAA, but I support the concept.
Sure.
And I want to add to your comments about the need for a customer satisfaction survey, because every time when I was representing the executive branch in various capacities abroad, a lot of folks who are resident off-island or who are there receiving medical care through the referral office, I'd say a large majority of them have their complaints and negative opinions, but I think as responsible government officials, it's important to have empirical data as to what it is exactly they're dissatisfied with,
Sure.
right? And so I think this is one step in that direction to capture that information. At the same time, though, Mr. Quabo, I see the value in when people literally go out of their way and almost overly ingratiate the government for having, maybe even saved their lives. And so
Sure.
it's important to capture that as a matter of record.
Sure, and I totally agree. And I'm not putting down the current medical referral assistance office. We work collaboratively with them, and they're a bunch of great people. So don't get me wrong, we're not directly attacking them. We're just trying to make the process more efficient to benefit the people who are being medically referred off-island. And I commend the authors of the bill that this is a step in the right direction of really streamlining a certain program in our government to better serve our people, because this is their money. It's taxpayer money.
Last comment.
Sure.
You're right. For the record, programmatic review and continuous improvement and assessment is a practice of healthy organizations. It's typical in accredited entities such as universities and colleges. So you're absolutely right. This is not a dig at the current operations or future operations. It's simply establishing by statute the need to capture this data and make improvement.
Thank you very much, Senator. I don't mean to put you on the spot, Bethany, but may I call you? May I invite you up front? Just a few questions. Terry, you can stay. Thanks, thank you. Okay. Bethany, if you can just introduce yourself and who you represent.
Sure. I'm Bethany Van Boxel, and I work in the Good Samaritan Patient Services office here in Guam. For the Good Samaritan Hospital located in Los Angeles.
Great, thank you very much. And so, my question is, I wanted to know what services does Good Sam provide? Because a lot of our patients do go to Good Sam. And a lot of the stories we hear are from patients that are at Good Sam and the struggles that they face when they're there. And I know that Good Sam, and I want to thank you, and please send this message back to your home base, that I thank them for providing a lot of times more than what you're really supposed to provide to our people that are there. You pay for their vouchers to get picked up. You provide food and lodging to our people who are stuck out there. So thank you very much for that. But if you can provide us, the committee, what other services that you do provide?
Sure. So we have an office here as well as a Guam Saipan office in Los Angeles that directly works with and does the coordination services and any assistance the patients need once they get to Los Angeles into the hospital. And that's outside of not just the appointment. It doesn't stop, our care doesn't stop at you have an appointment, it's scheduled, you've seen the appointment. It goes beyond that. So we have a coordinator over there, and she assists with if they need assistance with getting a ride, if it's something that they need, be going to a pharmacy or maybe even a store, groceries. They can't get a room, or the Weingart's full because we do have a hotel on the hospital campus. So if the Weingart's full, they've negotiated rates for overflow for hotels very near to the hospital, so that patients aren't stuck way out in the boonies of LA, so that they are close to the hospital, and that they do have transportation back and forth in the case that they do need it. So on top of that, if they do show up, we work with the Pacific Services, or our coordinator will get a hold of the Pacific Island. There's a Pacific Island club over there that can help with assistance in food or resources that they may need once they get there if they've run out of resources. So it's really about being there to support the patients, and not just for their medical care, but for emotional support, having some place to go when they do find themselves where I'm just stuck, I don't know what else to do, or I need a ride. So we're there to help and assist in any way, no matter which program is put in place or how the program evolves. It's really about being there for the patients and seeing the resources going directly to the patients. That's very important. So I know that's one program, that's something we can all get behind, is the resources going directly to the people and in the ways that they need them the most. No matter how the program evolves or which way it goes, we're there to help, we're there to assist in any way we can. We have an office there, we have a coordinator there, we have resources and expertise, and we're happy to assist.
Okay, great. Thank you very much for that. Does anyone have any questions? No? If not, okay, well, I want to thank you. I just wanted to get on record what are the services that Good Sam does provide.
Sure.
And then to thank you on record as well for that service. But to Guam Cancer Care and Terry as well, thank you for all that you provide to our community. So we'll continue to receive any written testimony from the public until such time we report this bill out and get it on the floor. Okay? Thank you very much. So the time now is 10:16. This hearing is adjourned.